Hello and welcome. Getting a new health diagnosis can feel pretty overwhelming, but knowledge, that's always the first step toward taking back control. So in this explainer, we're going to break down all the key information you need to really understand and manage hepatitis B. Let's just start with a really important question. What if a serious infection could be living in your body, maybe for years, without you ever feeling sick? Well, that's often exactly the case with hepatitis B. It's why it's sometimes called a silent infection, and it's why understanding it is just so important. The name itself actually tells us a whole lot. Let's break it down. Hepa, that refers to the liver, and itis, that just means inflammation. So, hepatitis is quite simply an inflammation of the liver. We're talking about a condition that irritates one of your body's most vital organs. A really great way to think about this is to picture your liver as this amazing, sophisticated filter for your body. It's constantly cleaning your blood, day in and day out. The hepatitis B virus, or HBV, specifically attacks that filter. And over time, that attack can make it a lot harder for your liver to do all of its essential jobs. Okay, so now that we've got a handle on what hepatitis B is, let's take a closer look at how it actually affects the liver. We're going to dive into what your liver does and why protecting it from this virus is so incredibly critical.
Your liver is an absolute powerhouse. I mean, it's not just filtering out toxins. It's also crucial for helping your blood clot, digesting your food, storing up energy for later, and even helping your body fight off other infections. It's involved in literally hundreds of different functions, which is why its health is so tied to your overall well-being.
Now, if it's left unmanaged for a long time, that chronic inflammation from HBV can lead down a path of increasing damage. It usually starts with something called fibrosis. That's just the beginning of scarring. This can then progress to cirrhosis, where the scarring becomes so severe that it really gets in the way of the liver's function. And in the most serious cases, it can lead to liver failure. But wait, before we go any further, it is absolutely vital to remember this progression is not a sure thing. Not at all. The most crucial point here is that with today's treatments and just consistent monitoring, you and your doctor can work together to protect your liver and prevent this kind of serious damage. And that brings us to a really key turning point, the diagnosis. This is where you get to move from that feeling of uncertainty and not knowing to the power of having clear, hard facts. So let's look at how doctors figure this out and what all the results actually mean. Okay, so there are two main types of infection. First, you have an acute infection. Think of this as a short-term illness lasting less than 6 months. For about 90% of healthy adults, their immune system will actually fight off and clear the virus all on its own. Then you have chronic infection. That's when the virus sticks around in the body for longer than 6 months. This is the type that needs that long-term management. And here's something that's really fascinating: how dramatically your age at the time of infection impacts the risk of it becoming chronic. Look at this. An infant infected at birth has a 90% chance of developing a chronic infection. For young children, it's about 50-50, but for a healthy adult, that risk plummets to just 10%. This really shows you why vaccinating babies is such a cornerstone of preventing this worldwide. Your blood test results can look like some kind of secret code, right? But they're actually pretty simple once you break them down. If your HBsAg test is positive, that means you have an active infection right now. If your anti-HBs is positive, that's great news. It means you're protected, either from a vaccine or from a past infection that your body cleared. And a positive anti-HBc just means you were exposed to the virus at some point in your life. Understanding these three is really the key to knowing your status. So, once you have that diagnosis, what's next? Well, let's talk about your treatment action plan. And it's not just about pills. It's about building a really strong partnership with your doctor to manage your health as a team. The goals of treatment are super clear, and honestly, they're really positive. The main goal is to suppress the virus. That means getting the amount of it in your blood, your viral load, way down. And when you do that, you prevent more damage to your liver, you reduce those long-term risks like cirrhosis and cancer, and, at the end of the day, you help yourself maintain a great quality of life. So there are two main ways to approach treatment. The most common one is a daily antiviral pill, things like entecavir or tenofovir. These are incredibly effective at keeping the virus down, and they usually have very few side effects. The other option is interferon. That's a series of injections that boosts your own immune system to fight the virus. It's used less often, mainly because it can come with some more challenging side effects. Okay, so what if your doctor says you don't need treatment right now? This happens all the time.
But it definitely doesn't mean you just do nothing. It means you've entered a phase of active monitoring. And this is a super important part of your care plan. It involves getting regular blood tests and liver ultrasounds, usually every 6 to 12 months, just to keep a close eye on what the virus and your liver are up to.
This brings us to our final section, and it's all about what you can do every single day. This is about creating your new normal and just living a full, healthy life.
All right, here is your simple checklist of positive things you can do. Being consistent with your medication is number one. Never miss those doctor's appointments. You can support your liver with a good, balanced diet and regular exercise. And hey, protect your liver from other viruses by getting a hepatitis A vaccine. It's also really important to tell close contacts so they can get tested and vaccinated to protect themselves.
And on the flip side, here are the crucial things to avoid. First, never ever stop or skip your medication without talking to your doctor. That can cause the virus to come roaring back. Alcohol is really tough on the liver, so it's best to just avoid it completely. And to keep others safe, don't share personal things like razors or toothbrushes, and don't donate blood or organs. Look, a diagnosis like this carries a lot of emotional weight, and it is completely normal to feel worried or anxious. Let yourself feel those things. One of the best ways to cope is to become your own best expert on your condition and to find support, whether it's from family, friends, or even a support group. You are definitely not alone in this. Through all of this, if there's just one thing to remember, it's this. While having family and friends on your side is wonderful, the single most important person you need in your corner is your healthcare provider. That partnership, it's the foundation of your entire long-term health plan. So just remember that a diagnosis is not the end of the story. It's really the beginning of a new chapter, one where you are informed and you are in control of your health. So the question I want to leave you with is this. What's going to be the first step you take in writing that new chapter?